My name is Melissa Cole, and I'm a nurse in the case management department at Children's Hospital here in St. Paul, where I've spent the last 36 years of my nursing career. I also currently have the privilege to be part of the children's negotiation team for the third time. If you're thinking that this all seems very familiar, that's because it is. It wasn't that long ago that nurses lined these sidewalks during the largest nurses' strike in U.S. history. We did see some improvements during our last contract campaign. However, our priority issues remain the same. They are significant and unchanged. Our hospitals continue to focus on their bottom lines and CEO salaries at the expense of patient care, safety, support, and the retention of both seasoned and new nurses. In a recent article on Children's Internet that we have fondly dubbed fake news, a nursing director is quoted as saying, "It's one thing to talk about staffing, it's another to act on it, and we are." Our data proves otherwise. Children's nurses continue to have serious concerns about the staffing in our facilities. Since ratifying our last contract in December of 2022, nurses have continued to file concern for safe staffing reports with the Minnesota Nurses Association at alarming rates. Children's Minneapolis has submitted 3,715 reports. Children's St. Paul has submitted 2,806. This means that in just 30 months, there was over 6,500 instances in which a nurse was concerned about the safety of their assignment. Let's be real, that number is extremely underreported. Our youngest, most vulnerable patients didn't get the care their nurse felt they needed or deserved. These patients are our children, grandchildren, nieces, nephews, and neighbors. They deserve better, and so do our nurses. Children's Chief Nursing Officer, who by the way has been noticeably absent from these negotiations, is also quoted in the same internet article as saying, "Nurses' voices are central to what we are building." We agree. Nurses are key. Yet no one at Children's or any of the hospitals across the Metro and Twin Ports seem to be listening. Nurses have been sharing their experiences of unsafe staffing with tone-deaf hospital leadership teams. We've presented a comprehensive staffing proposal that provides for the safe care of patients. It includes patient-to-nurse ratios that cap unsafe workloads, accountability measures to ensure that safe staffing is actually enforced. This model has already proven successful in other states. And in fact, just yesterday, the state of Nevada legislature passed Senate Bill 182 that will set minimum nursing standards and ratios in all Nevada hospitals. A group of politicians understood that improving patient care and safety was critical, and they needed to do it at the legislature. It's interesting, though, our hospital administration, many of who came from bedside, simply are not interested in this idea. Meanwhile, leadership claims they also are deeply engaged in improving the daily experiences of nurses at every level, from staffing, safety, to support. We have met for 9 negotiation sessions. While we've reached some minor agreements, we've seen minimal movement on the real substantive issues. Despite claiming that they're listening to nurses, leadership has consistently ignored proposals aimed at recruiting and retaining nurses and improving the daily experience for both staff and patients. Instead, under the guise of modernizing our contract, Children's leadership has proposed significant rollbacks and concessions, including forcing nurses to float to the Children's campus on the other side of the river, a place that they are not familiar with, forcing nurses into the charge role, nearly tripling the amount of time a nurse can be canceled and go unpaid, limiting accrual of earned benefits, restricting when you can use those earned benefits, and weakening the grievance process. So yes, we've heard a lot of talk about supporting nurses, but when it comes to action, we are still waiting. We didn't become nurses to be ignored, overworked, or treated like numbers on a spreadsheet. We became nurses to care, to advocate, and to lead, even when it's hard, even when it's uncomfortable, and especially when it's necessary. This isn't about a contract. It's about patient safety. It's about our working conditions, and it's about finally being heard. And here we are, united, along with all the other Metro and Duluth facilities under contract negotiations, and we are not backing down because our patients deserve better, and so do we. Thank you.
Good morning. Thank you, Melissa, for that. My name is Tammy Anderson, and I am a registered nurse at North Memorial in Robbinsdale, where I've worked my entire career of 35 years. North Memorial CEO Trevor Sawalis recently made comments in the Star Tribune alluding to financial troubles at North Memorial in the Robbinsdale campus, going so far as saying North Memorial and Robbinsdale might have to close. Nurses have a proposal to alleviate the financial burden on North Memorial and Robbinsdale. Staff turnover is a large expense for hospitals, and our proposals would help keep nurses at the bedside. Our proposals to establish enough nurses per patient would also increase patient safety and health outcomes. It's a win-win. Yet hospital management repeatedly has told nurses in negotiations they are, quote, not interested in our proposals that address staffing, workplace violence, and fair benefits. It appears they are not interested in supporting nurses and extending the life of their hospital. What they are interested in are their proposals, like mandatory on-call and not paying overtime. That essentially would drive nurses away from North Memorial, a decrease patient safety, and be a detriment to the community. We're here today because we want to make this community better, and we want to help North Memorial Health Robbinsdale. Thank you.
Morning. Thanks for being here. My name is Asher Hearnden. I'm a nurse at United Hospital, and I work on the oncology unit. I care for people with complex, life-threatening illnesses, patients who are going through some of the most difficult, vulnerable moments of their lives. Like every nurse here, I became a nurse to take care of people, to provide comfort, and to treat people with dignity and compassion, especially when they need it most. But here's the truth. We can't give that kind of care anymore. Not with the staffing ratios we're working under. This system is breaking down, and it's hurting patients. Right now, we're so understaffed that one nurse can be responsible for 3, 4, and up to 5 complex patients at once. That's not just hard, it's unsafe. Allina Health, the corporation that runs United Hospital, is knowingly staffing us at the 40th percentile nationally. That means that most hospitals, 60% of the hospitals in the country, have more nurses on the floor than we do. While we're being told to deliver exceptional care, we're being set up to fail because when there aren't enough of us, the patients pay the price. Let me give you an example. It's one of many. I was taking care of a patient receiving end-of-life care. With the limited time I had, I was able to help manage his pain and create a calm environment. His loved ones had been able to spend time with him and were hoping he would remain comfortable throughout the night. But I was also caring for multiple other patients with acute needs. One of them required close monitoring and frequent assessments. I was doing everything I could, but there simply wasn't enough time or enough staff. By the time I got back to check on my first patient, he had passed, alone, without family, with no one there to hold his hand. It's not because we don't care. It's because there weren't enough of us to be there for him. Another patient who was also seriously ill tried to get to the bathroom alone after their call light went unanswered. Every nurse was tied up with urgent patient needs. That person fell. They suffered serious injuries, and it should never have happened. These are not rare events. These are predictable outcomes of chronic, dangerous understaffing. And let me be clear, this is not a staffing issue. This is a staffing crisis. It's not just hurting nurses, it's hurting patients, real people, our neighbors, our community, our families. We can't provide safe care if we're stretched past the breaking point. We can't offer peace and dignity if we're just trying to keep people stable minute to minute. This isn't about burnout or bad days. This is about a system that's running on empty and pretending everything's fine It's not fine. People are dying alone. People are getting hurt. And the worst part is that it doesn't have to be this way. Alina Health has the resources to fix this. They're choosing not to. And while they sit on comfortable margins, we nurses are the ones holding the line, and the patients are the ones falling through the cracks. So we're here on the sidewalk, in the sun, in there in our scrubs, because we're not giving up on our patients. We're calling for safe staffing. We're calling for dignity, and we're calling for a healthcare system that actually puts care first. We're ready to work together. We're ready to fix this, but we need Alina, the public, and our communities to stand with us. Because if you or someone you love ends up in a hospital bed tomorrow, you want a nurse who has the time, the training, and the support to be fully present. We're fighting to make sure that's still possible. Thank you.